because there are criteria that is set, and I don't think money is even. We're surviving.
You sure of that?
We don't have money to survive. And what was quite interesting was one of our own, United Methodists, who graced the occasion. His Excellency, the President of the Republic of Liberia, crowned me.
He crowned you?
Oh yeah, the church. And I remember his voice that everything I touch is power, is Methodist. And so the crown I'm putting on your head, we should work together to do everything for the church and the society to better the lives of our people.
Okay.
And so that was excellent for me.
So you invited him, or the church invited him?
Both.
Okay.
He's a United Methodist, so he goes to our churches. He goes there all the time and worship there. He's from the Georgia Party.
So for the president to crown you, Dr. Nyenswah, it means that you got a very good rapport with the president.
We are United Methodists, number one. Number two, you know where the president comes from. Nyenswah is from Science.
Oh, that's our Eastern connection.
The Southeastern solidarity is there. We share United Methodist solidarity and all that. And so he's our president.
Okay.
We're doing everything possible to support the government. For me, I'm a government person. Is leading the charge, and so we have to support. And this is what I'm noted of doing, making sure that contributing my part. The puzzle is not correct when the other piece is out. So we are there to give support to the work that the president does. So my loyalty, and also for the church.
Dr. Nyenswah.
Thank you so much. It's always a pleasure.
Okay.
You are the guru. You celebrity when it comes to the radio and talk show and all of that. Thanks for the great job. What we do is, since the national crisis, when the Ebola crisis subsided, we try to build capacity. Some of the things that we didn't have, the National Emergency Operations Center, the one hosting my office, and we built 15 of those also, though not at the same size, at each of the 15 counties. So if you move to our headquarters in the county health team headquarters, you will note that every county health team has an EOC.
Close to the counties.
Right. They are seated with the county health team, because it's supposed to give logistical support, communication network, and everything that's supposed to be done for public health emergency. So
build them on the resources of NPHIL or some donor partners?
We brought in like 100 plus across the country in Ganta. We met there and provided public health emergency training for our EOC staff, so that they can be more effective and robust if there's anything that happens in the counties, to respond effectively and on time. Our response capacity should be not more than 72 action, like like an alert system. If there is a disease that we're tracking, for example, if there's a cholera outbreak, measles, or yellow fever, meningitis, those kind of deadly diseases, infectious diseases, we track them. For you to do that is to decentralize the system, the emergency operations system. It's a week-long training, and then we had 2 cohorts of the exercise. About 100 people were trained, which includes county surveillance officers, county diagnostics for 9 months, the basis for 3 to 4 months. Over all of our people in 93 districts of this country, health districts now, not political, trained with the kind of fit for purpose field epidemiologists that can do the work, track diseases, look at the trends of an outbreak of a disease, be able to report and analyze, do an epidemic curve, whether or not the onset of the disease. So coordination with our colleagues in our sister countries, the cross-border collaboration with Sierra Leone, Guinea, the Ivory Coast, the information, we share surveillance data together, research information, and we were able to know within 24 hours, even before the information that was taking place in Sierra Leone. It is important to do it, to act as if to say that a real thing is happening. So you look at every spectrum of the society to know whether or not How will the media react? What kind of story the media will be reporting?
Okay.
So it's a whole barrage of system testing, to know whether or not the system is working. That was done in collaboration with the CDC office in Sierra Leone.
Okay,
and,
but looking at trying to determine as to whether the system is working or not. Let's hear from you our level of capacity.
So of 93 health districts in this country, we have at least a trained field epidemiologist that is deployed, and at all 15 counties, epidemiologists are deployed. We
deploy with the requisite
on the field. It's tedious to go to the kind of terrain that they go to, but we all do it as a sacrifice for our country to get the surveillance system working. So
are they the same individuals you had at the border points? Because there were people deployed there before to determine to test people, conduct tests on people who were coming into the country. Whether
international airport did all of the things that they're supposed to do, ask for yellow book and all of that, and have why. So he came to the big meeting that I was chairing and looked in my face and said, Mr. Nyenswah, I'm highly proud of
in nearby
ERC where Ebola is raging right now.
Surely.
So it's a continuous process. Healthcare is capacity to exist at all times so that you can track. So we have to keep people, the surveillance team moving in, doing case definition, testing the cases. We also have specimen transport team through the Riders for Health, one of our premier organizations that moves samples from every part of Liberia and move it to the National Reference Laboratory for testing. The World Bank is giving a lot of support.
To get grants, but there are reports of new infectious diseases popping up. Do we have capacity? Do you know of them? And if so, do we have capacity to tackle them?
It's not unique to Liberia, but globally we looking at a trend of new infectious emerging diseases that are popping up because of climate change, because that animals used to be and insects and things that carrying highly infectious experiencing that kind of thing. This is the first time that we see places that certain diseases were not, those diseases are occurring there now because we are the National Public Health Institute, my team and myself.
Okay, so you're listening to the Bumper Show right here on the OBC 99.9 and other frequencies across Mama Liberia. Our guest on this final lap is the Director General of the National Public Health Institute, Director General Tolbert Nyenswah. Let's look at our capacity now, laboratory capacity. Let me be specific. I know during the Ebola period we had to send specimen abroad and before we can determine as to.
Now it will take us 24 to 48 hours to do that. Less than 1 or 2 days to do that.
Why?
Capacity. We build a capacity in the lab. We have reagent there, including transport. The US CDC, the government of Liberia is also providing resources to make sure that our reference lab is functional and testing more than the capacity we have pre to do that testing. We brought a capacity now in Liberia, so our reference lab.
So you have trained personnel to handle that.
Very trained. Okay. Part of the trained people we have are those molecular biology, parasitology, those testing that we can do, the parasites, bacteria, viruses. We now have the capacity to do that. So basically, our lab does have the level of capacity that we need as a country. We're not there yet, 100%. There are some specimens that we send abroad. Most of the challenges we're having is to validate some of our results. Okay. So, for example, if your lab is pre-qualified at a certain level, whether it's level 2, level 3, level 4 lab, based on the test you can do, you must send some of your specimen abroad to know whether or not the testing you are doing is correct, then you are pre-qualified.
Okay.
So we've been going through stages of pre-qualification with our African region colleagues and other colleagues that we're working with on the lab.
Okay. So in terms of having a high level of qualification or capacity, laboratory capacity, we are not there yet.
No, we are there. In terms of the the pathogens and some of the diseases that we have here. We're testing for measles. Measles is one of our diseases that affect our children.
Okay.
We're testing for meningitis. We didn't have that capacity before. We're testing for yellow fever. We're testing for the big brother, Ebola. We're testing for Lassa fever. One of the things that really endemic in our society today. Before Liberia was considered, there were 3 countries that we were considering as the meningitis. We're responding to outbreaks as I speak right now. But so because of the work that has been done in the last 3 years, people don't notice when we have an outbreak of those kind of diseases.
Okay.
Our team is dealing with Lassa is the small brother of Ebola. They are almost the same hemorrhagic, blood diseases, quick to kill, but we have the capacity to treat it thanks to our clinicians, meaning the doctors and nurses that are working. Once we identify the cases, that are doing everything possible to cure people. Testing capacity and all of that. So yes, a lot of effort.
You sound as if all is well with the National Public Health Institute.
All is not well. So we're keeping it moving.
Where are your lacks? What are you lacking so far?
Some of the things, we need more trained people. Our institution is scientific. It should be evidence-based. Research should be core. We're doing a couple of research, but we are not at the level where other countries are in terms of research. We visited our colleagues in Mali and Ghana. They are far ahead of us. So we require for you to have a research institution, you must have qualified people. So the World Bank, people in various areas of research, and 13 master's degrees to come, join the Ministry of Agriculture, Health, and the National Public Health Institute under our One Health program through the World Bank support. So in the next couple of weeks, maybe 6 weeks, we should be identifying qualified Liberians that we can send to universities in Africa, America, and Europe to get, in the next 4 years, to get people to a minister, or making you a deputy minister, assistant, or director in an office. If the capacity is not there to do the work, you put more burden on the government.
Sure.
Productivity will be minimized. You will maximize the kind of things that the government should do, especially in a resource-constrained poor setting.
Okay.
You need trained people who will mobilize additional resources out there. Grant writing, proposal writing, technical skills to do the work that you're supposed to do. If you don't have directors with a BSc degree, it's not the same as a director with 2 masters, PhD, and writing grants.
Surely.
I have some of my directors that are personal investigators to grant a BSc degree, and you say directors, that's deceiving ourselves and stabbing ourselves in the back. I don't support that. And this is why I'm advocating for
But that's what the government is talking about is harmonization.
That harmonization does not go. We should do it with very good intentions, do it cleverly, find out people's credentials, what productivity they bring to government. Because if next door you have an NGO who can pay you better, you will flee the country and go and work for that NGO. People will resign. And my institution is one of them that have very smart, qualified, talented Liberians we need to maintain. If I train 6 PhD...
Let me confirm this with you. I understand, Mr. Director General, that bulk of the work you do or resources that come to the NPHIL is as a result of proposals that you send out.
That's correct. So it's costing us to run the lab that just 2 years, $30-some million a year.
30-some million?
Exactly. Reagent, staff, equipment. It's $30-some million a year. The government can't afford that. To run that reference, folks to go out, we buying computers, we training them to train them. The research that we do, the Prevail study, the research in the demographic and health survey that is coming online soon. And other CDC is co-located in my office. They have their own, their country director have an office there because we work with them transparently. They see what we do, and so they're supporting the system.
Mr. Director General, have your institution, when I say have you, I'm making reference to NPHIL, Have you secured a vaccine now for hepatitis B for health?
Nice in this country, professionals that to protect them as public health technicians. 55,014 of them have received their vaccine 100%. The JDJ hospital have vaccinated 231 out of the 280 healthcare workers. They're going 83%.
Okay.
Redemption Hospital going 76%. This is good. The second phase of you take 3 doses before you are completed.
Okay.
You take the first dose, and after a month or so, you take the second and the third dose after 6 months. So the vaccine is enough to cover all the vaccines to protect healthcare workers for both. Every human being is important, especially in population health.
Surely.
So one of the things that we're doing right now is to do a prevalence survey. If you don't know the magnitude of the problem, you cannot tackle it in the best important way. So as part of the demographic and health survey, one of the things we included in there is to test for hepatitis B in a population.
Okay.
How many people, what's the prevalence of the disease in the population? We want to see. So if the prevalence of the disease is above 5% to 10%, find out from local pharmacy, find out from Abia, and all of the
vaccines for the public.
What I'm telling you now, the way to go is to first of all know the magnitude in the general population. The reason we target healthcare workers was the efficient way. Somebody takes a lot of money. The reason why some gaps were created after the Ebola crisis is because we lost over 192 healthcare workers in this country that died from Ebola. Some of them were specialists. I know of a key specialist doctor who died from the JFK hospital. Not 1, not 2, not 3. To train somebody like that would take you 10 years.
Okay.
So why sit down and succumb to disease like hepatitis? I have a colleague who I was working with, disease, you need to vaccinate the entire adult population. But the hepatitis vaccines is part of the pentavalent vaccine that we gave to children too.
Okay.
So children are immunized. The people who are moderates are people who were born after the age, if I'm correct, 1989 or so. Is life protecting.
Mr. Minister, Mr. Director General, very, very shortly.
I was minister before. So I
know very well. Very shortly I'll be opening the lines. But before I go to the lines, let me ask you and get your opinion on this. You are part of this system, of this sector, the health sector, and every time you hear about the lack of drugs and medical supplies, you hear about
bring the healthcare system to its needs and made the system to collapse. You were here, you didn't go anywhere. Hospitals were closed down, medical workers flee the facilities, and all of that. So after that ugly situation, Mr. George and my listening public, they legally left. Put together something called the investment plan for building a resilient healthcare system in Liberia. And the goal was to build a resilient healthcare system which not only restores the gains lost due to EVD crisis, but that also provides health security for people of Liberia by reducing risks, coverage by improving access to safe and quality health services. That was the goal. And that plan was costed from 2015 to 2021. It would cost Liberia $1 billion in terms of that plan, not Tolbert Nyenswah's figure. An analysis was done by health economists, $424 million. Between 2018 to 2021, Liberia needs $597 million to support the healthcare system, meaning you put all the productive, motivated healthcare workers, re-engineer the health infrastructure, put in place the... For somebody to tell me that we budgeted 40 million or 60 million or 80 million for health, and we gave 80% of that money to the healthcare system to run. You haven't given anything to health. The health system of Liberia, only 16% of that budget is provided by government. The rest, 60-something percent, come from donors. And support that. Somebody was telling me the other day they bought $4 million worth of drug and they brought the containers at the airport. $4 million worth of drugs. That's JFK's drugs you buy there. They're not for the country. So people need to figure out, go back to the investment plan that was developed. It was well thought through, analyzed, and follow that plan. You follow that plan, find the resources, you state centers, and who go to the hospital and health centers are the rich people. The poor people, the poor, we say we're running out of clinics. And those clinics are those that we neglect. So that's the problem we're facing here.
You sound to be speaking as an expert.
That's the problem here, Sabo. So we need to sit down. It doesn't take a rocket scientist to know that out-of-pocket spending in Liberia is more than 43%. Meaning, people who put hand in their pocket today. I was talking to a colleague who went to a hospital. They said the person needed $1. Trust me, how many pimping guys can afford that if they had a head fracture or collision and something happened to them? So out of pocket is high. Free healthcare system is not working, it's not sustainable. Only 16% of institutional spending from government. Ask me a question, my honest opinion. We're not presenting the real picture. So, present the picture. Explain to the people, this is what I have, this is what I don't have, this is what I need. And be passionate about that. Period.
08805140996 or better still 0778776 089713. That's the numbers to call, and then you'll be live on this program. Let's get the first call in line. Hello? Hello, caller? Oh, okay. We lost this one. Okay.
My name is Mohammed Kamara.
Okay, go ahead, brother, here quickly.
But they got to be careful. They got to be there to take care of life and property.
Well, I don't think he understands what we're talking about. 0776-089-713 or 0880-514-096. That's the numbers to call.
Our public health director Cllr, Tolbert Nyenswah. He actually he's very an important point about the healthcare that is biased. So at times you see they are going to take country health just to keep their life going. So I think there's a need that one of those recommendations that he made, there should be a reapproach. Okay.
Okay. Thank you very much. This is a caller on the line. Hello, caller. Hello. 0776-089-713. This caller on the line. Yes. Good evening. Yes. Good evening. Good evening.
Hello.
Yes. Your name and where you calling from? Good evening.
Hello.
Yes. Go ahead. Oh my. Hello? Hello? Oh, we lost this caller. We lost this one. 0776-089-713 or better still 0880-514-096. That's the numbers to call.
For the expectation, these are some of the things that we should be hearing in this country. Yes, there a high level of professional in this area. And those recommendations are recommendations that should be good for the poor people to support them. Because the poor person should not die because they can't afford to take medication. So 100% support his expertise, and 100% support everything, every recommendation.
Oh, no, we're not getting from this line. It seems that... Hello, caller?
Yeah, hello, hi,
I'm okay, quickly.
I'm able to call from Nima County, San.
Okay, let's hear from you.
Yeah, because you talk about the food, you got $150 US money spending me. Can't imagine around Motor and get a kind of problem. I wouldn't understand that more energy or enjoy it. You go with the coming power. You're not still in the dream, bro. For me, I thank you for letting effort in the health system.
Okay, thank you very much. Let's see what we can take this other call on the line. Yes, hello? Wow. Hello? We can't continue with that. Let's take this final caller quickly. Hello, caller?
Hello?
Yes, good evening. Your name and where you calling from quickly?
I'm Uriah, so I'm calling from the direction. Oh, please, I just want to...
Oh no, we don't have the resources yet. Once we work on that, it took us time to mobilize the. It cost a lot of money to do that. One of our partners called Griffiths Prototypes, and some of the people we're working with doing a research on plasma. We're doing some research, taking the blood, and we asked the partners. And the reason why the hepatitis issue came about, some of the people that were going to donate their blood at the plasma center, we noticed that we were seeing more cases of hepatitis B than even HIV and AIDS.
Okay.
So we said, okay, if it is in a small group of population like this that's coming down with the virus, then what we need to do is to find the resources to protect healthcare workers, because when the people get sick, they will go to the hospital.
Okay.
So that was the reason. But we don't have the resources now to make sure that we buy it for the entire population.
Your parting comments.
So my recommendation, well, thank you for having me. And at the National Public Health Institute, we're doing everything we can do to protect the population of Liberia. We saw what Ebola did and disrupt the situation. We don't want a single disease coming here to disrupt the proper agenda of the government, because all we do is to support the effort of this government to make sure that diseases don't disrupt the system. I want the Minister of Finance to go to bed sleeping and don't think about something. We are concerned about what's taking place in the DRC, and this is why we're building our own system and giving advice to what's taking place in the DRC. WHO quite recently of international concern in DRC because the trichots does not reach to that level yet, but the advice.
Well, George is my name, and there's no second chance.